My name is Michelle Bruno, and this is my presentation on migraines in women. For my presentation, I'm going to review what migraines are, their symptoms, the triggers, prevention and treatment, my interview with Kristen Allman, and also with Gretchen Chronister. Migraines are a neurological disorder. 38 million people in the United States suffer from migraines, and 18% of women suffer migraines. They are debilitating headaches, and they are often accompanied with other neurological symptoms. These symptoms can include an aura, which you see in the top picture here, is a visual disturbance, and this often happens prior to the onset of the migraine. Migraines are often one-sided, but 1/3 of people that get them do get them in both sides of the head. Often, once you have a migraine, there can be other symptoms such as sensitivity to light, sounds, and smells. There can be mood changes, neck pain, nausea, vomiting, and often afterwards there's lingering fatigue. Some common triggers for migraines are stress. There are many food triggers such as chocolate, red wine, MSG, and processed foods. Changing in sleeping patterns can bring on migraines. And the biggest one for women is estrogen levels. So the increase in estrogen can actually increase the frequency of migraines and also the strength of them. These are often increased through the reproductive years, so that about 30% of women during those years will suffer a migraine. Contraceptives, oral contraceptives can increase migraines as well. So if it's the pill that has the different hormone levels, and then the 4th week where it's the sugar pills, often that week where you're taking the sugar pills, there's that rapid decrease, can trigger the migraines as well. So a contraceptive such as the NuvaRing or the Depo shots have a sustained level for this and cause less migraines. For prevention and treatment of migraines, avoiding triggers is one of the best ways to avoid a migraine. There are also daily prescriptions that can be given to chronic migraine sufferers. And a chronic migraine sufferer is someone who gets migraines 15 days out of a month, and that would be diagnosed by your primary care provider or specialist. There are also prescriptions for when an attack occurs, such as Imitrex, which can be taken via pill. They have shots, and there's a nasal spray as well. There are other treatments as well. Non-steroidal anti-inflammatories are over-the-counter medications such as Motrin. If you take those too many days in a row, they can cause rebound headaches, and sometimes a steroid is needed to actually stop that cycle. My interview was with Kristen Allman. She is actually my sister. She is 37 years old, and she suffered migraines since high school. She gets her migraines in both sides of her head and in her neck. She doesn't have any symptoms before the migraine comes on, so she has no aura. She is very sensitive to light, sound, and she gets vertigo as well. And usually for about 2 days afterwards, she's just not feeling up to speed. She often, during her attack, has to rely on other people either to take her home or pick her up. She has to sleep through the migraine usually, as it's that debilitating she can't get any work done. She finds her largest trigger to be stress, and she manages that with over-the-counter medications and massage. And she did notice that her migraines almost stopped after stopping her oral contraceptives. I interviewed Gretchen Chronister from WellSpan Neurology. She is the PA there. We had talked about the biggest trigger for women is actually the hormones, which is what I had researched as well. She said the menstrual migraines often come either mid-cycle or at the end of the month. But triggers can be difficult to determine across the board for women and men. And they can be weather, seasonal allergies, smells, food, stress. Treatment for women, there is not much there that's just for women. Frova is a prescription that is approved for menstrual migraines, but it is also used to treat men as well. And then resources for women, there is nothing specific, no programs or anything in the area for women to look for support or help with their migraines. But there is plenty of educational material that is given out in regards to the triggers, exercises to reduce neck stress and strain, and headache calendars are given out to help track migraines. In conclusion, migraines are the 6th most disabling illness in the world. 3 out of 4 migraine sufferers are women. 90% of sufferers are unable to function productively during an attack. Triggers and preventative action and working closely with your provider can help to reduce the frequency of the migraines and to improve quality of life. Thank you.